So many patients has not undergone FFR, many patients has not undergone physiological testing. So the previous trial which showed that you need to go for complete revascular, many operator has extrapolated the data to here. So this is not a very robust trial to say that we should go for complete revascularization and
this was done at one sitting or
no, multiple sitting, multiple sitting. One sitting again, it is not recommended. So first sitting is only culprit vessel. Index admission you can go for other vessels. Sometimes if patient is not stable, you can go for stage intervention also. But generally all trials, whatever till now, Dynami, Prime Multi, CV Multi Prime, and everyone said that in index admission, you have to go for the total revascular admission.
So this risk reduction is relative risk reduction.
Relative risk reduction. It's not absolute risk reduction.
Right?
No,
this is nothing actually.
It is relative risk reduction. It is relative. But this is in extension of the previous trials. But again, they have not even separated which are small vessels, which are large vessels. They have intervened for small vessels or large. That was also not.
Longest follow-up વાળું છે 17% છે એની p value પાછી non significant.
Non significant.
This is to improve the CV rather than prime.
Yes.
At a paper published there.
Yes. Then something about mineralocorticoid receptor antagonist. This we will discuss in detail in Cardcon for sure because we have half an hour 45-minute session for this.
હા તમારી પાસે બાયર નો સેશન હશે આમાં.
ના Sun Pharma નો છે.
Sun Pharma વાળા લઈ આવ્યા
એ લઈ આવ્યા ને એ લોકો ફિંગરીનો લેવા.
ફિંગરનો લેગિંગ હજુ એક નામ છે ઝાયલા.
લાવ્યા ના હોય એ આ એકોનો માર્કેટિંગ પાર્ટનર હોય લાવી ના શકે કારણ કે હજી પેટન્ટ માં છે ફિંગરનો.
ના they have launched.
ના એટલે
પોસિબલ છે કે એના પાસેથી લઈને માર્કેટ
લઈને પછી એ લોકો
માર્કેટિંગ પાર્ટનર હોય લોન્ચ ના થાય અત્યારે નથી. બાજી હજી લગભગ 3 વર્ષની લોન્ચ થાય.
So they have not sponsored that lecture. Lecture was already there.
Prabhu.
But they are also one of the sponsors.
સ્પીકર તમારી હોસ્પિટલના છે કે બહાર?
Speaker આવે.
હા
Speaker એટલે ભાવેશ વિદ્યાર્થી.
અચ્છા ભાવેશભાઈ છે.
So this is the MRI meta-analysis. And that said that MRI reduce the risk of cardiovascular event in patients with heart failure with reduced ejection fraction also and heart failure with preserved ejection fraction also. So that is known. This is only meta-analysis to confirm the previous findings. What is new is about Finrenol. Finrenol reduce heart failure events and cardiovascular death in heart failure with preserved ejection fraction also. The previous trial of Finrenol they told us that it is helpful in heart failure with reduced ejection fraction, and now this fine arts heart failure, it is helpful in mid-range as well as preserved ejection fraction also. The reduction of cardiovascular event is significant. Even secondary endpoint, all-cause mortality, composite kidney output. Kidney output, although p-value were not significant, all-cause mortality p-value was significant.
ફાઇન આર્ટ્સ ટ્રાયલ ને એવું છે
Fine art and then one more that is fine art.
This is actually nothing significant. Huh?
This is only significant is this versus placebo.
Unfortunately,
See, you need to understand one thing. Joe, mean follow-up is 32 months.
That is because new.
Okay, so it is almost 2.5 months. Yes, right. So now in a clinical practice, when you will expect a heart failure with preserved ejection fraction person to die,
It's not weeks, it's years.
So this is the catch point. So preserved ejection fraction માં તમારું 20-25% relative risk reduction is actually nothing.
And till now we don't have trial of Finrenol versus other MRIs.
I'm putting this
We don't have that trial.
head-to-head trials.
Head-to-head trials. Even there are not small data also. Only on Finrenol versus placebo. Finrenol versus placebo.
Closest opposition to Finrenol right now is SGLT2 inhibitor, right? And they are having so much level of robust data right now.
SGLT2 is far beyond Finrenol, and
many times in nephrology they clearly says that use Finrenol only after SGLT2 maximum dose tolerable.
Company is comparing Finrenol with Arni. We can't compare Finrenol with Arni. We can't compare
કંપનીના જે મેનેજર આવે છે ને એ કંપનીના મેનેજર નેફ્રોલોજીસ્ટ ને કાર્ડિયોલોજીસ્ટ ને પ્રેશરાઇઝ કરી રહ્યા છે કે ફિન્ડ્રોનોલ લખો પણ ગાઈડલાઈન તમે કેડિકો ની જોશો, ACCHA જોશો, ESC જો બધામાં ક્લિયર લખેલું છે give for SGLT2 inhibitor.
And even MRA guidelines says pyronol.
Unfortunately, this drug works beyond SGLT2 as an antifibrotic.
Antifibrotic. So maybe for kidney long term, maybe for heart long term, maybe it will show good data, but we don't have that data yet.
Absolutely, because we don't have the follow-up of that process.
We don't have that data. For at least cardiac, we don't have that data yet.
પણ આપણા બધા પેશન્ટોની અંદર હાઇપરકેલેમિયા બહુ થઈ જાય છે, આ ખબર નહીં સંભવ છે.
Hyperkalemia is less. I have not used it drug very frequently. So
ના બહુ જ ફ્રીક્વન્ટ, મતલબ ઓલમોસ્ટ 20% કરતા વધારે થાય છે.
બહુ જ ફ્રીક્વન્ટલી થઈ જાય છે. એ લોકો જે કહે છે ને એના કરતા ફિંગરિંગથી તમારું હાઇપરકેલેમિયા એટલું જોરદાર થઈ
So
જાય.
I'll tell you one thing, SGLT2 inhibitor જો તમે પ્રોપર ડોઝમાં આપેલું હશે ને પછી હાર્ટ ફેલિયર હશે, CKD હશે, ડાયાબિટીક હશે, જો એમને માઇક્રોઆલ્બ્યુમિન્યુરિયા અથવા CKD સ્ટેજ 3 સ્ટેજ 4 લગી ગયું હશે તો એમાં રિકવરી ઇઝ ઇનવેરિયેબલ
okay.
and you will almost never need Findrenone after that. Right? So Findrenone ના પ્રિસ્ક્રિપ્શન જે બી માર્કેટમાં ફરે છે એમાંથી 80% આ આપણે એવું નથી કેવું ખોટા છે પણ ડિબેટેબલ છે.
અને ફિનરિનોનથી જે હાઇપરકેલેમિયા થાય છે ઓલમોસ્ટ મોર ધેન 50% ની અંદર થાય છે એવું આપણા એશિયન ઇન્ડિયાની અંદર કહી શકાય. અને એ લોકો કહે છે તરત રિવર્સિબલ છે ને એ બધું પણ મુશ્કેલી કરી શકે આપણે પાટી પડે.
Once hyperkalemia occurs, it is difficult.
કાર્ડિયોલોજીમાં
Difficult.
And another thing is you will see so many prescription of Findrenone right now. It is being given by nephrologists in a cardiac patient without SGLT2 inhibitor.
Absolutely.
Right? This is what is going on. Right?
I have not used it.
Yeah,
It is
આવા
very
બધા
costly.
આવે છે દરરોજ હાથમાં આજકાલ.
It's very costly.
It is costly, but see,
Eplerenone is equally effective.
Eplerenone is good. Even spironol alone is very
Spironol is
good.
good. Only if the gynecomastia is there, you get away from it.
Yes. Yes.
ના બટ આ લોકોએ નવું પોકેટ શું કાઢ્યું કે મિડ રેટ અને પ્રિઝર્વ ડિજેક્શન ફ્રેક્શન અને આના ડેટા છે બીજા કોઈના પોઝિટિવ ડેટા નથી એટલે બધા ફોર્સ
Okay.
એ સિમ્પલ એસ
But anyway, SGLT2 inhibitor is data everywhere.
Yeah.
Or heart failure with preserved, heart failure with mid-range, heart failure with reduced. Everywhere.
લેક્ચર પછી તમારા બધા પર પ્રેશર વધી જવાનું છે યાદ રાખ. બસ
Yeah, I don't give it. Guarantee વાળા કેટલી વાર આયા લખવા માટે. I have written in one patient single as of now. ये वक्त भी संकेत सोनी હતો. So it was a combined patient. So that patient lived well for 2-3 years and then he was 15% EF, he did not survive.
He died because of this.
ના બટ there are genuine patient કે જેમાં ASCVD છે, ડાયાબિટીસ છે, early CKD છે, SGLT2 inhibitor નો maximum tolerable dose with full compliance ચાલે છે and if your kidney parameters are not improving, give Findrenone.
Okay.
There are patients પણ આ લેવલ લગીનું ફોલો અપ કમ્પ્લીટ ટાઈમલાઈનમાં જોઈને પછી આપવાનું.
Patients are with nephrologist for regular follow.
ના હવે બધા જ કોર્ટ્સમાં પડે છે, કાર્ડિયાકમાં પડે, ફિઝિશિયનમાં, ડાયાબમાં, એન્ડોમાં, નેફ્રોમાં બધે જ આ પેશન્ટ આવે છે. પણ આ આટલું તમે બધા ચેક પોઈન્ટ થતા હોય બરોબર છે કે ભાઈ એસસીવીડી છે, ડાયાબિટીસ છે, અર્લી સીકેડી છે, SGLT2 છે, લે છે અને છતાં યોર EGFR is reducing, your USCR is not improving, provided તમારી કોઈ ફંક્શનલ કે એનાટોમિકલ એબ્નોર્માલિટી યુરિનરી ટ્રેકમાં નથી and it is still there, give Findrenone. It is a good drug.
Okay. So particular subset of patients.
Yeah, of course.
Okay, then nowadays very discussed is
Designed to solve the problem traditional drug-eluting stents cannot, achieving more than simply propping a vessel open by allowing healing and resumption of natural vessel motion and function. Dynamics starts by opening the vessel and restoring blood flow, increasing the diameter of the inner vessel without compromising or restricting the natural healing processes. Right after implantation and through the first 3 months, the drug is released for controlled growth of healthy new tissue over dynamics. Following natural resorption of the biodegradable polymer coating after 6 months, the magic happens. Dynamics' unique design allows it to unlock itself. Restoration of vessel motion and function occurs when each of the device's helical strands unlock from each other. Rather than simply creating a channel for flow, the freed vessel pulses, bends, and twists, indicative of healthy artery function. The naturally to every heartbeat, increasing blood flow and sending more blood further into the heart. In some patients, together with lipid-lowering medication, Dynamics has even shown reduction of treated plaque, a finding not previously seen with drug-eluting stents. At last, the vessel is returned to a more natural physiology, adapting and maintaining optimal lumen size, while the bioadapter continues to provide dynamic support for long-term health.
Based on same principle, absorbable stent came on based on same principle, that you allow vessel to move. So this is, but unfortunately that did not get absorbed properly. So that has been withdrawn from market. Again, Marilys launched. We don't have any long-term data for that also.
This looks more of a marketing gimmick rather than anything.
Possible.
કેટલા મોટા
This is
છે?
only for 6 months.
I tell you one thing. You tell me કે આ hinges વાળો છે, બરાબર?
Yes.
કેટલી લેન્થ પછી hinges કામ કરશે? You try to imagine કે તમે ખાલી 1 કે 3 સેન્ટીમીટર નો સ્ટેન્ડ મૂક્યો છે.
It
બરાબર
must
છે?
be
હાર્ટ ની
smaller
અંદર.
stents.
Okay? અને એ epithelialize થઈ જાય છે. See that stent is not working by its own. It is there inside vessel. Now it is epithelialized. હવે તમે મને એવું કહો છો કે hinges એને natural physiology આપે. It's absolutely bullshit.
It's difficult, but let's see what
Yeah.
long-term data will say.
Yeah.
As of now, it is only for 6
આ
months.
લોંગ ટર્મ ડેટા આવવાના જ નથી. 5 વર્ષ પછી આ ચેન્જ થઈ જાય. 5 વર્ષમાં લોકો
પછી
આ સ્ટેન્ટ 1 લાખનો છે, પેલો 2 લાખનો છે એમ કરીને કમાઈ લેશે. That's it.
Maybe. Then other trials are for OCT that I think will skip.
હવે કેટલું છે પ્રભુ?
નહીં, હવે હું skip જ કરવાનો છું.
ના તો હવે નેક્સ્ટ વીક
ના, next
મજા આવે તો
week
સ્કીપ તો કેમ કરેલા? આવતા વીકે કર ને.
Next week
I am
I
sure that the trials are for this TAVI, transcutaneous mitral valve, and then there are multiple
આ
trials
તમને
in atrial
પાંત્રીસ લેવલે
fibrillation.
જવું છે.
I think atrial fibrillation will take next time. TAVI, there is nothing much in TAVI. Only one significant trial is that whether you should go TAVI
George
with this.
died.
Sorry.
Only George Cherian died.
હા.
Yes, yes.
Chariot side is after TAVI, ના?